Hi, I'm Christine Olivieri, your paleo practitioner. Today's video lesson is going to focus on modern sick care as opposed to health care. Because as a nationally board certified nurse practitioner, I have a unique view about what our modern health care system is really all about. Unfortunately, modern medicine and big pharmaceutical companies really don't want to cure you of your disease. The medical community needs sick people. Granted, there are some problems that affect your health which we really don't know much about. But I can tell you one thing that I've learned being in this field for many years. Other than certain birth defects and injuries, 90% of disease starts with chronic inflammation, which is sparked by environmental factors. That means that the foods we choose to eat, the water we drink, the air we breathe, how we deal with stress, whether or not we're very physically active, in other words, lifestyle choices. Early man did not really die of disease. This we know from anthropological evidence. Generally, they died of injury, infection, murder, childbirth, birth defects, and starvation. But modern disease is really the result of living in close quarters, such as poor sanitation and poor lifestyle choices. We accept disease as part of modern life, but we can generally avoid this. Most medical providers do not have the time and often the expertise to provide you with all the lifestyle modification education that you may need to remain healthy or get healthy. I learned recently from attending the 29th Annual American Diabetes Association Clinical Conference, and Sean Sullivan, who is one of the attorneys for the American Diabetes Association, said, physicians are not trained to keep you healthy and avoid disease. They are trained to deal with the disease. See, you can get a lot of unbiased, evidence-based research results and education here on this website. Watch as many video lessons as you can, and often. Let's talk a little bit about chronic diseases of the modern world. Now, most chronic diseases that we see nowadays were virtually unknown in the ancient world among hunter-gatherers. We know this because we're currently studying hunter-gatherer cultures that are alive today on the planet now. They don't have problems like cardiovascular disease, which includes hypertension, stroke, heart attack, heart failure. They virtually do not see any diabetes, obesity, prediabetes, type 1 or type 2 diabetes. They don't see any COPD, which is chronic obstructive pulmonary disease, which is almost always a result of smoking. They really don't see cancer, which is a disease that we now know through recent research has a genetic component, but you're not born predestined to get cancer. The genetic component is that environmental factors turn on and mutate a gene, and then you develop your cancer. Other diseases that the ancient world did not see was arthritis. We want to believe that arthritis is just a result of getting older. It is not. It is now believed through modern research that arthritis is the result of the development of AGEs, which are AGEs. Those are accelerated glycated end products, which is the result of the glycation or the processing of sugar. You eat foods that are very high in sugar or turn to sugar, your body develops more AGEs. These AGEs are deposited inside your arteries and more than likely in large quantities in your joints, actually in the cartilage, crumbling the cartilage as you get older. Other diseases that were virtually unheard of in the ancient world were neurological disorders, like ADHD, which is attention deficit and hyperactivity disorder, autism, Alzheimer's, depression, and many different types of mental illness like schizophrenia. Now, I'm not saying these things didn't occur, but they certainly didn't occur in the amounts that they're occurring in the modern world. These diseases often start with chronic inflammation. What happens is you end up developing, after years of chronic inflammation, insulin resistance. Then your blood sugar rises, which increases the inflammation. You'll learn more about this if you watch some of the video lessons specifically about diabetes education. And if you think that you're not one of the people who have to watch those videos, you're probably wrong, because we now know that 1 out of 3 Americans over the age of 20 have insulin resistance and prediabetes. Are you one in those 3? Early signs are so often missed by medical providers. It's not hard to identify these markers. Simple blood tests, like an A1C, are not done on a regular basis. You need to be proactive and ask your doctor, what is the result of my A1C? It's a simple blood test, and it's a strong indicator of how your body is running metabolically. Again, you'll learn more about an A1C blood test by watching some of the diabetes education video lessons. What is the cure for all of this? Lifestyle modifications. Again, it all starts with chronic inflammation, leads to insulin resistance, which makes you develop belly fat, which is a very, very dangerous kind of fat. Then that leads to more insulin resistance, and then your blood sugars finally start to rise. That's the last thing that rises. And out of all of the blood test markers, the last one to rise is your fasting sugar, which is usually the blood test that your doctor is basing you on. He'll miss diabetes by years if that's the only blood test that he's marking. So unfortunately, this is what most medical providers are looking at exclusively. So you can't fix what you don't know. Please know your numbers. What is your A1C? What is your weight? Is my BMI too high? Which will often cause your blood pressure to go high. So again, an A1C is a much better indicator of what's really going on. Now, an A1C is not perfect, but it will identify most people that are at high risk for developing diabetes, which is prediabetes. Now, our current healthcare system, many people already have 1 or 2 complications of diabetes, and they haven't even gotten their formal diagnosis yet. So prediabetes is nothing to fool around with. Through chart reviews, I've seen many patients who have an A1C of 7%, which is in the category of diabetes. But the fasting blood sugar was only 91, which is under 100. So the doctor never said a word to the patient, but this patient was clearly a diabetic. I've also seen plenty of chart reviews where the fasting blood sugar is 100 to 150, which is prediabetes into diabetes. But they've never run a single A1C on the patient. And when I saw those chart reviews, the serum creatinine was already at 2.0. This is a blood test that lets me know this patient already has kidney disease. So how our sick care system deals with all of this? Unfortunately, not well. Our average office visit in the doctor's office is 10 minutes long. And unfortunately, it just treats the symptoms of disease. Rarely does it address the disease itself. The second thing that our sick care system does well, big pharmaceutical companies are king. Your office visit simply turns into a balancing act of medications. Your blood pressure's a little high, your weight's a little high, the doctor will just balance out your medications. Take more of this, take less of this. It's a balancing act. But never once is the actual disease being addressed, just the symptoms of the disease. Therefore, through the years, you will get sicker. It is a provider-centered care system. That means that it's all about your provider providing you care, but not really curing your disease. What our current system needs is to focus on being a patient-centered care system, where the patient is king, where your actual disease is addressed. But because we run currently on a provider-centered care system, eventually the patient gets blamed. So what happens is you're told that you're not following the doctor's program, you're not doing what is being told, maybe you're not taking your medications regularly because of side effects or because of cost, and the patient gets blamed. So what is true health care? It's helping someone to make difficult lifestyle behavior changes. That's what should be king, because that addresses the actual disease rather than just the symptoms of your disease. That can actually practically cure your disease. And societal beliefs change slowly. Beliefs like, what is a normal, healthy breakfast? How much should I move around every day? Do I need to exercise to the point where I'm dripping with sweat? What's wrong with sitting around watching TV for 6 or 8 hours? These are the belief systems we have to change. So part of societal belief changes will require a little bit more belief in yourself to be able to make the change, and less belief in what the media touts as evidence. Again, more information about this can be found in other video lessons. Patient-centered care is based on what the patient wants to do, not what the doctor demands. And it's really important that you do get a chance to do what you want to do to improve your health. Because one thing that we know when it comes to patient making changes in their life is that patients will not make changes to their life if it's not important to them. So the doctor can stand on his head and jump up and down, but if you do not want to make those particular changes, whether it's quitting cigarettes or starting an exercise program or changing what you eat, none of that's going to happen unless you want to. After we receive some basic education about our health problems, most people know exactly what they need to do. The problem is they don't often act on it. That's where motivational interviewing comes in, and hopefully your medical practitioner is educated in how to do motivational interviewing. What most people need is a caring, educated practitioner who takes the time to educate you and help you to make the difficult changes in your behavior that leads to more health. Finding a practitioner that is skilled in motivational interviewing or brief action planning is a good first step. The more patients are armed with information, the more changes can happen. Ask your doctor if he understands about motivational interviewing. It's a good technique to help patients to identify behaviors that need modification. And we have over 300 clinical trials proving that it works. What motivational interviewing is a technique that your medical provider learns how to do to help the patient to make very difficult lifestyle changes. One of the handouts that are available for download on this website actually is a sheet to help you to do motivational interviewing. What it is really is your medical provider will help you to make difficult lifestyle changes through a series of questions that you answer. One example would be, I might say to a patient, what do you want to change in your life? Now, like I said, most patients know what they need to change in their life. So let's say you say, I want to exercise more, but I don't know how to get started. So I would say, if you want to start to exercise more, what would you like to do? The patient may say, I want to walk. So my job as a healthcare provider, using motivational interviewing, would say, when do you want to walk? How long do you want to walk for? How many days per week do you want to walk? And where do you want to walk? So basically, it's laying out a very specific plan about one aspect of your life that you would like to change to become more healthy. And hopefully, your medical practitioner has learned some of these techniques. It's not easy to change behaviors and beliefs in what constitutes a healthy diet or a healthy lifestyle. Many people are simply at a loss on how to get started. And it's insulting to a patient for a doctor to say, you need to lose weight, you need to exercise more, watch your diet, and then simply just walk out of the room. But this is how our sick care system currently works. Thank you for enjoying this video lesson. I hope you look forward to many more.